Hey, this is Sarah with RegisteredNurseRN.com, and today I want to talk to you about Foley catheters. Sometime during your nursing career or as a nursing student, you will get the chance to insert a Foley catheter. So in this video, I just want to talk about the kit itself, what's included in the kit, and how you prep everything before you actually insert a Foley catheter on a patient. In the next video I'm going to make, so be sure to check that out, I'm going to show you how to actually insert a Foley catheter in a patient. I'll be using a mannequin, and so watch that to actually see the skill in place. So first you'll want to get your Foley catheter kit. They come like this. They're stocked in your clean hold on your unit. Be sure whenever you grab your kit that you get a kit that contains the Foley bag and the prep supplies, because some kits just have the prep supplies or just the drainage bag. So be sure you read, because there's a piece of paper on the inside of the bag of what it contains. So you get your kit and you open it up. This one's already open, but what you do is you just peel it back and this flap will come off. I like to use this plastic bag that it comes in as my trash bag, because you'll have things you'll need to throw away. But it's your preference. I've learned over the years it's a lot easier. Your kit will come in here. You just slide it out and be very careful. And put your bag aside. And around this kit is your sterile field. You have 2 inches to grab on the edges so you won't contaminate your sterile field. So what you do is you carefully just peel it back and you'll be exposing your kit, which everything inside of here is sterile. So be careful and turn your kit to the side. Whenever you're actually inserting this on a patient, it's good to have your patient in the bed and have your bedside table on the side and put your tray next to that and get on the side where you can use your dominant hand easily. So in the next video, like I said, you'll be seeing me actually do that. Okay, in your kit, you have a bunch of different stuff. First thing right here is a drape. This is a sterile drape that you will use to put over your patient to protect the sterile field. I'm going to show you what it looks like. See that little opening that can go over the penis area or the vagina area, just to keep the area nice and sterile. And next are your gloves. And after you put your drape on, you want to get your gloves. They have the tray set up pretty much how everything is stacked is how you are going to be using it. So you'll get your gloves and take your gloves and lay them beside of you, and you're going to be putting on these sterile gloves. There's a special technique on how to put on sterile gloves. I have a video on how to do that, so if you're not aware of how to put on sterile gloves, please watch that video. So I'm going to put these on. Now I have my sterile gloves on. Now I can touch everything that's in this kit. Normally, because my hands, I didn't have my sterile gloves on, I couldn't touch anything in the kit. The only thing I could really touch was the drape that you would drape the patient. So the reason that they put the drape first, and you don't want to use your sterile gloves putting on the drape on the patient, is because you increase the chance of you actually contaminating your hands. So it's okay to do the drape first without your sterile gloves on, because you'll decrease your chances of contaminating them. Here's another drape if you needed it. You can put that underneath the patient's bottom, whatever you want to do. It's really your preference of if you want to use that or not. Some people like to use a drape, some people don't. It's really how you were taught. The next thing in this kit, you have these tweezers, and you have iodine, which is betadine. A lot of patients are allergic to this. Again, check allergies to make sure your patient isn't allergic to this. If they are, you'll have to use a different type of prep. What you will do with this is that you will tear this off. I'm not going to tear this off right now, but you would normally tear it off. And you have these 3 cotton balls right here. Okay? And you have more right here. You actually have a total of 6. What you do is tear it off and you drizzle your betadine on this and get them saturated. Next, you have this is just a specimen cup. A lot of doctors will order you to insert the Foley catheter and then get a urine specimen. So you will use that if you need that. And you also have your 10 cc sterile water. It inflates your bulb, because before you ever insert a Foley catheter, you always check the bulb to make sure it works. Believe it or not, whenever I was fixing to insert a Foley catheter on a patient, I checked my bulb just like I was supposed to, and the bulb would not inflate at all. It was a bad Foley, so I had to throw it away and I had to get a new kit and start all over. So that's why you always check your Foley bulb, because sometimes they don't work. And then this right here is your lubricant. This is what you will lubricate the Foley catheter up with, because it will be dry, and to make it more comfortable for the patient when you insert it into the urethra, this lubricant will help it slide a lot easier. Okay, so below your kit is the Foley bag and the Foley catheter itself. Right here, this is the part that will actually go into your patient, okay? This port right here is where you insert the 10 cc sterile water syringe to inflate this bulb, which I'll show you here in a second what that will look like to check your bulb. And then this port right here is where you would stick a syringe to suck out your specimen for your urine. So that's what those two ports are. And the urine, once you insert your Foley, there's two little holes right here, and once it hits the bladder, it will start to fill with urine, and it'll start to turn yellow right here with the urine draining, and you know that you're in. And the tube will collect the urine, and gravity will help the urine flow into the bag. And to empty your Foley catheter, this is where you would empty it. You unsnap it there and empty it and then clamp it back. So that's how that works. So let me show you how to insert or fill up your bulb. So first what you would do, you would get your Betadine ready and get that, and you would want to check your bulb. So you would pop this little cap off, just set it on the side, and then you're going to connect to this. Just easily connects like that. Make sure it's on there good. And you're going to watch your bulb inflate. And do you see it inflating? Inflates beautifully. And then I like to just wait about 30 seconds, look for any leaks, make sure it's all good and it looks great. Now, after you wait for about 30 seconds, you deflate it, and this syringe, you actually just let go, and the plunger just sucks the water back in, and it deflates like that. I like to keep my syringe connected to that, because whenever I insert the Foley, it's just easier to just inject the sterile water. Once you hit the bladder, you don't have to connect and fumble and have to mess with everything, so that's best. Okay, right before, another tip, right before I actually insert the Foley, I keep this in the plastic thing, because whenever you're messing around with this kit, this thing's gonna be flying everywhere. You don't want this to hit outside or anything like this, or anything, because it'll contaminate it, and you increase your patient's risk of getting a UTI or anything. So I like to keep it in this plastic wrap until I'm actually fixing to insert, because it decreases the chances of contamination. Here's your lubricant. Like I said, we'll use this to lubricate the area before, or lubricate the catheter before we insert it. I like to just tear that off and just squirt it in my tray, swish it around in lubricant, and then I'm ready to go. So that's everything that's in your kit. One thing that doesn't come in most Foley kits is the little secure device that you would put on the patient's thigh to keep the Foley in place. So always be sure that you grab that, because that will help decrease the Foley moving from getting pulled out when the patient moves. So always do that. So that's what's in your Foley kit. And in my next video, I'm going to show you how to actually insert the Foley, so be sure to check that out. And if you have any questions about Foley catheter kits or your experience, share your experience about it, please come to the website, registerednursern.com, and visit the forum. And if you like this video, please share it with your friends, and thank you so much for watching.